Dr. Nami, how do you define concierge dentistry at Green Dentistry, and what makes it different from a traditional dental practice, especially for holistic minded patients?
Sure, that's a great question. A concierge practice like mine, it does a deep dive into the patient, starting with the medical history, starting to connecting with the medical doctors, naturopaths, sometimes even acupuncturists or even osteopaths, really doing a deep dive on what the patient's problem is. Then what we do is we diagnose through testing. So we are not just taking x-rays and saying you have a cavity and you need a cleaning. What we actually do is deep dive into you. What we want to check is your genetics, your oral microbiome. We want to do sleep. We're going to look at how is your sleep. What is your oxygen saturation like? What is your heart rate variability? What is your stress levels like? What are your nitric oxide levels like? So we're doing a deep dive into you and really figuring where the problem could be. And once we discover the problems, what we're doing is doing the treatment, triaging with your medical doctors, especially if you're a patient who has cancer, if you have chronic illness, or if you're a biooptimizer. It's really crucial that everything is laser dialed in on what you specifically need so that all the work that you may be doing or with chronic illness or with cancer or biooptimizing with your medical doctors is done in a way that's synergistic. What that does is that it actually allows two practitioners to come together to take better care of you. We can help you save time, effort, energy, money, right? And give you the one thing you want, which is total confidence in health. And that total confidence in health is the key because we, as providers, a dentist, a medical doctor, dentist, osteopath, dentist, naturopath, connect and say, these are the findings that I'm seeing. This is how it's going to influence what you're doing on this patient. So, this is what you need to modify so that everything is linked together. There's none of this, it's all synergistic work that really gives you the best outcome while saving you time and money.
So, what are some of the specific treatments that are typical in a concierge plan, and how do you tailor those to the specific individual that you're working with?
So it depends on the person and what they need. I would say that 80% of my patients are going to be somebody who's been struggling with chronic illness, somebody who has cancer or autoimmune dysfunction. The other thing that we're looking at is biooptimizers, people who want to biohack. So they're the three main patients of my practice. And the first testing is standard. It's going to be the medical history, right? We are going to get to know each person, figure out is exactly what's going on. Some of the patients have genetic predispositions. Some of them, there's no idea why they're having the disease that they are. Then we start looking at the symptoms. Okay, what are your symptoms? How can dentistry be related to that? And let's start with some diagnostic testing. So that testing includes a 3D CBCT so that we can look at you going down, going forward, and really look at you in 3D from your sinus cavity, well, from your brain to your eyes, to your sinus cavities, to your tongue position, to your arches, to your airway, to your spinal column, and really making sure that everything is in place because we now know when C1 to C3 is in place, which is going to be your spinal column, everything else aligns much better. All the cranial nerves are working properly. We're really looking at, of course, any root canals, any amalgam fillings, any gum disease, any specific bacteria that would be problematic for each of the diseases. We're also looking at sleep, the heart rate, heart variability, how many hours of sleep, what is your diet like, what are you doing to recoup, are there stressful moments, what's your originating moment when the stress began, because stress induces cortisol, and cortisol is just a bad thing for your body because it keeps it in constant fight or flight stage versus rest and digest. So we really go deep down, figure all these things out. And as we do that, we're working with the medical doctors to say, hey, These are the concerns. This is what I'm discovering. I'd like to know what you're doing. So how can we work together so that we can make sure that this patient gets the best outcome? Sometimes patients are on, doing treatment, like IV treatments for cancer patients, right? They're going in, getting their blood cleaned out, sometimes weekly, sometimes biweekly if they're stage 4. And they're still living. These patients are still living because of all the work that we're doing together. They're doing that from a medical side. From the dental side, I'm making sure the microbiome is balanced and in proper position. I'm making sure they don't have sleep variability. They're sleeping much better, they're optimizing much better, and they're regenerating much better so that all the good stuff that they're getting through IV therapy is now going to work much better because the body is going to be able to regenerate quicker, faster, more efficiently, and stay there.
Tell me a little bit more about airway and sleep testing, especially for patients who might have sleep apnea and things like that. How does that play a role in their oral health and in this concierge model?
Awesome. Thank you for that question. That's actually a really good question. So, we are not just looking for sleep apnea, we're actually looking for upper airway resistance, which turns into sleep apnea within about 5 years or so. So, first, we're looking at every stage of your life. There's certain things that happen at certain ages: 50s, 60s, 70s, 80s, 90s, and so forth. Our goal is to help you make sure that you don't get Alzheimer's, right? You have your ability and mobility, right? And then also arthritis as well as cancer and all these life-threatening conditions, which is, cancer, heart attacks, also prevent all of those. And the way we do that is we look at upper airway resistance. We look at your 3D nasal volume. We look at your tongue position. We look at your windpipe and we test you. So the test is very easy. You wear a ring and it's in the comfort of your own home. So the data is very accurate. You're not sleeping in the lab. You're in the comfort of your own home. You're doing what you normally do before going to sleep and what you normally do when you wake up. This gives us a lot of tangible information because now we know what your nightly routine is like. We know what you're doing before bed. We know what's happening during your sleep that is correlated. We also know how you're waking up. And this is really important in so many different ways because we want sleep to be the most important thing you do. It's going to be regenerative. And even if you get 4 hours of sleep, we want that sleep to be good REM sleep, which is rapid eye movement, because that's when your body focuses on healing. And that's where my energy and focus is going to be to make sure that I can get you there. But I always have to know where I'm starting. So we do this testing in the comfort of your own home. We combine that with your medical history and your symptoms. Then we take that and add a CBCT to it, to 3D structure of what you look like. So is something structurally off? Is something chemically off? Or is something off by hygiene? Or is it just stress? So we can figure out and pinpoint exactly what the problem is, and we can address it and we can fix it.
Can you share a story of a patient where concierge level coordination meaningfully changed their outcome?
Absolutely, absolutely. I'm going to share my patient, Cynthia. She is a lovely, adorable 62-year-old female. Came to me because a medical doctor had referred her to my practice, and she's been through cancer 3 times. And she's had cancer 3 times. And so, they just couldn't figure out why it keeps recurring, and so they send her to me. We do our oral microbiome test. We discover this bacteria. We remove them. We see her genetics. She is at high disposition for cancer, as well as heart attack, diabetes, and Alzheimer and arthritis. She was also starting to have some symptoms of Alzheimer's. That were present. She was also very anxious and, started developing tremors, was just really nervous. And also clinically, I mean, she had cancer, right? She had cancer 3 times. And technically, if you cure the cancer once, it usually stays away for a while, as long as the diet and exercise and all those things are handled. But she was extremely phobic of going to the dentist. So she hadn't been to a dentist in like 10 years. She came to me I coordinated with the doctor, and at that time she had liver cancer. So liver is really important in all of our body functions, right? It detoxifies her body, so that was very important. We looked inside her mouth. We tested the microbiome. We tested her sleep. It turned out that she had braces when she was 8 years old, and then she had braces again when she was 12 years old. And it turned out that she decided to do another round of Invisalign in her 30s. And so what that kept doing is shrinking her sinus cavities. So we were able to see that on the scans. So once we were able to see that on the scans, we were able to come up with a diagnosis and also a report for the medical doctor. So as we gave this report to the medical doctor, they looked at, oh my gosh, I see what you're saying. Let's make sure we get this bacteria out of her system. Let's make sure her toxic burden is lowered. Let's make sure she has good rest. And that's what I do, so that when they're doing their IV therapies or when they're giving her the chemo, it's actually working better. And I tell you, so often I get doctors who call me and say, I only want to work with you. The reason being is I see that the results are better for my patients. And the results are better when I coordinate with them, because we triage and say, hey, how's this patient doing? What can we do better? And what we find is that these patients are doing so much better for their services, and they're healing faster and staying healthier longer. And I'm proud to say that it's been 12 years and her cancer is still gone. And it's really wonderful to be able to see that, because her recurrence before was every 3 years.
For patients that might be considering this type of concierge level dentistry, what are the real costs and benefits in terms of, their improved health and reduced emergencies and long term health gains? Who's right for the practice and who might not be?
Sure. So I always say that if you want to add 10 years to your life, easily 10 years, and the insurance company values your life at $120,000 a year, so that would be $1 million. I am not going to charge you that, obviously. So, are there fees? Absolutely, because it takes time. There is so much testing, there's so much information that we're doing behind the scenes, and especially getting to that root, especially when we're getting to that root cause and that causative factor. So there's a cause and an effect, right? When we get to that cause and we really need to fix it properly, some things are easily done within a day or two. Sometimes things take a little bit longer and multiple visits. So that will add, obviously healthcare is costly, right? So it will add a cost to it. And especially when we're looking at treatments that are 2, 3, 4, 5 years or so, there is an investment to it. So if you're the kind of person, my practice is a right fit for somebody who wants to get better and is willing to pay for it. Doesn't mean you have to have all the money up front. We have financing. We're happy to help, but that right mindset and coachability has to be number one. If you don't have the right mindset, if you just want to argue with me and argue with anybody or argue with any results or the data that it gives you, you're probably not the right person for my practice. If you're a person that wants help but doesn't want to pay for it and doesn't want to, respect my time or energy, you're probably not the right fit for the practice. But if you're somebody who knows, like, hey, I understand what you're doing. I want to get better, and I understand that it's going to take more time and more energy than an average person. So it's going to cost me a little bit more, and it's a fair price. Then you're the right fit for me, because then we can come up with a customized, personalized game plan for you. We can phase treatment, but what we're going to be doing is making you better. And instead of you going to the wrong place and getting sicker, what you'll be doing with me is we'll be making a comprehensive plan that fits within your budget, and be making you better. We'll be building trust. We're going to make sure that you look good, you feel good, you live a long life, you keep your teeth and avoid pain. And so that's what we're going to be able to do together. And yes, there's a price tag associated, but it's not $1 million. It's not $100,000. Like, there are some concierge practices that will charge that. So average cost in my practice for comprehensive care can be, 5 to 10,000. If it's longer term treatment, we're looking at 20 or something along those lines, just so people have a number to keep in mind. But and everything that I do is data tested, so we're results oriented. We'll do test before and test after, so that you can see that you've gotten the results that you were seeking. And we work really hard to really make sure that we're helping our patients, because this is my life's mission. And it's we're also adding in so many different things with behind the scenes information, with coordinating with medical doctors' offices, connecting with them, and merely the whole team is doing that. There's follow-up care. There's so much that is involved in that. And there's a clear distinction in a concierge dental practice, as well as how different it is than than a regular dental practice. A concierge practice is where you're going to want to come. You'll feel safe. Somebody's on your side, and somebody who's your friend, but also somebody who knows their stuff and is going to give you results and is going to take you through the finish line.